Good evening to one and all, and welcome to the 17th episode of the PGC Weekly Podcast. I'm your host, Saurabh Kaura, and I'm a coursework officer on the Postgraduate Council. The Postgraduate Council, as you all know, is a student body that represents, supports, and advocates for all the postgraduate students at UNSW. So if you have got any questions or concerns for us, feel free to reach out to us. I would also like to start the podcast series by acknowledging and paying my respects to the Bidjigal and Gadigal peoples who are the traditional custodians of the lands where each of our UNSW campuses are located, and all the Aboriginal and Torres Strait Islanders, elders past, present, and emerging, as well as their communities who have continued to share and practice their teachings over thousands of years. We recognize all the Aboriginal and Torres Strait Islander people's ongoing leadership and contributions, including to business, education, and industry. Just for the basic Zoom etiquette before we begin, we request that if you are on Zoom currently, you remain on mute at all times. And if you have a question to use, don't forget to use the raise hand button, and I will allow you to ask your question or put it on the chat support. Also, just before we start, this podcast is a very special podcast in association with the September Week 2021. And I would like to give a big thanks to all the people who are working behind the scenes, and as well as our September sponsors that make this event possible. We are grateful to have Figure as a bronze sponsor supporting this event. So if you are interested, go check out their website, thefigure.com. Or you can also visit the September website, where you can also see all other kinds of fantastic events organized by September this year. I've been in awe of the events in this organized till now, and I'm sure you're going to love this one as well. Today, we have got three wonderful guests amidst us today. One, we have Sylvester Okeke. Sylvester is a PhD scholar at the Center for Social Research in Health, UNSW Sydney. He's also Research and Strategy Project Officer at Australian Red Cross. He has field and research experience in adolescents and young adults' sexual behavior and its psychological and socio-cultural determinants. His research and community services are foregrounded on sexual health promotion and risk reduction among young people and evidence-based interventions and policies. Secondly, we have Dr. Jessica Elmasry, who is a general practice registrar working at the UNSW Health Service. She studied medicine at UNSW and has since completed a master's in global health at UCID, a research thesis with the European Institute of Policy Research and Human Rights, and is currently undertaking a certificate in female sexual and reproductive health. Jessica is also a current voting member with the Australian Medical Association and sits on the Federal Public Health Committee advocating for health promotion in government policy. She is passionate about sexual and mental health and enjoys working with young people to empower them to make informed choices about their health. And finally, we have got somebody from the Postgraduate Council itself. Guess who? It's the Women's Officer of PGC 2021, Saltanat, Paritova, who is also studying Masters of Commerce from UNSW Business School. So what a great combination of people we have today to discuss on this topic of how to better manage your sexual health at university life. And that's what we thought, that if we have a doctor, if we also have an international student, we can have those perspectives, as well as a PhD student who is doing a research. Starting off the conversations with Jessica, on this very important point of how to manage your sexual health at university life. What do you have to say on that, Jessica?
Thank you so much for the introduction and the great question. So how can we better manage our sexual health at uni? We really want everyone to be feeling happy and safe and confident in all aspects of their sexual health. And part of that is knowing how to prevent STIs and unintended pregnancies. So arm yourself with as much knowledge as you can. If you haven't already, have an STI check every 6 months or with every new partner, or if you develop any new symptoms. find a GP that you feel comfortable with, that you can talk freely with about any of your questions and concerns, and have lots of open conversations with other students, because sex is not something that we need to be ashamed of, and it's something that we need to talk about to empower each other.
Absolutely. Also from, research point of view, Sylvester, because, you have been researching a lot in this area, would you like to comment something for the betterment of the university students who are listening to us, related to how they can better manage their sexual health? And then we'll delve into more questions as well.
Thank you so much for this opportunity. And thank you, Dr. Jessica. I will just sort of stress some things that she has said. Sex is not something we should be ashamed of. Sex is an aspect of our humanity we cannot deny. So we should be confident to talk about sex. We should be confident to seek help. We should be confident to say no. We should be confident to also say yes when it has to do with having sex or not having sex.
Absolutely. And I think, some people are just afraid of that because they feel that it might be taken in the wrong way in the community. It might defame their name, or, people might think about them in a different way. But as you rightly pointed out, how important it is sometimes to open up about that and talk about that, because, it can affect a lot of other things, happening with your body. From an international student point of view, I also wanted to ask Saltanat, because, she transitioned from one country to Australia. And probably if you want to share your experience as an international student, so that people who are also an international student can relate with your story and can understand how important it is for them.
Thanks, Saurabh. Thanks for introduction, and I'm really excited to be here today with you and talk about sexual health from international students' perspective and also postgrad student perspective. Well, sexual health is just a part of the overall human well-being, and it's very important to acknowledge that. And I do believe that students, especially international students, when you come from one culture to another, it's not only about just adapting, but also knowing where you can get information, where you can get help, what kind of resources there are available for you to maintain your sexual health. And I'm really excited to talk about this today with you.
Absolutely. Now, getting into some, questions which really go deeper into the conversation, Dr. Jessica, is one of the main questions that students might want to ask is how frequently should they get tested for the STI? Because that is a key question for them, isn't it?
And it's a really important question. The answer depends on the type of sex you're having and how frequently you are having sex and the number of partners you're having. It's not the same answer for everyone. For example, for men who have sex with men, we recommend 3 to 6 monthly screening, particularly if there's a lot of new partners, but that might not necessarily be the case if you've got the same partner. And for everyone else, we recommend every 6 months or with every new partner change. Now, if you are with the same partner long term, that's not necessarily the case. But for most people, and just as a general rule, we just say every 6 months to get tested.
Absolutely. And how important do you think, is safety and domestic violence with respect to sexual health?
It's a very, very important public health issue, and that is really underestimated. I mean, it's so common. Probably 1 in 4 women will experience some sort of domestic violence at some stage. And it's actually one of the leading causes of unintended pregnancy as well, unfortunately. So, as a GP and working at UNSW, we do see some domestic violence and we do see unintended pregnancies, and it's something that is happening. So it's something that we need to be talking about.
Yep. And, it's quite a surprise how the COVID-19 situation has also affected a lot of factors. And I think that's where I wanted to bring in Sylvester, where he's also researching a lot on that. What do you think, Sylvester? How does the current COVID-19 situation signify for the infectious STI diseases, or what kind of impact this current situation has on that, according to your research and, whatever you have been reading about that?
Thank you so much. Based on the evidence we have, the impact of COVID in relation to sexually transmissible infections and then blood-borne viruses like HIV is very complex in that we are seeing very low level of notifications, which is to say that cases are falling. But we do know that it could also be because people don't frequently go to tests because of the disruptions in these sexual health services. We also do know from the literature and from primary research that COVID-19's impact on STI's risk is also mixed and complex. COVID-19 restrictions and lockdown have sort of restricted movements and mixing, which in a sense could drive down STIs. In the same vein, these lockdowns and restrictions have also increased sexual risk among some. So that's why I said it's a very complex thing. So there is no one answer for that question. But evidence that we're seeing is cases are falling, but we do know that it is because less people are going for tests, less people are going for screening. So obviously cases should be down.
Also, Saltanat, continuing from where Sylvester just left, how do you think, COVID-19 might have impacted international students such as you during these situations related to this issue?
Thanks. Yes, obviously, COVID-19 lockdown specifically impacted students, people around the globe. And it's not because the topic of this week's September is healthy relationship. And being some students, some people were impacted in a way that they found themselves away from their significant others, and that also had a significant impact on the mental health. Although does, for example, New South Wales regulation do allow for compassionate visiting, including when people are in a relationship but don't live together. But I do believe that there is more effect on the mental health, especially when people are separated from their loved ones. And we do need to talk about it. And I think there are services at UNSW, especially, we do have some counseling services that can help people to overcome those challenges.
Absolutely. And that's what I wanted to know. A lot of students might not be aware of the different support services that UNSW is providing. So probably, Dr. Jessica, if you can talk about what are the different support services that the students are being offered. Also for the new students, I think it can be a good knowledge addition.
Yeah, of course. So just to go following on from what Saltanat was saying, we have CAPS, which is a counselling and psychological support service, which is free for all students. And that's located on top of the UNSW Health Service in the Quadrangle. And it's really, really easy to get an appointment. If you go online and Google psychology and wellness at UNSW, or maybe we can provide a link here in the chat, and you follow the links through Mental Health Connect, someone will give you a call within 1 to 2 days and organise a catch up with you. And you can have 3 sessions with a psychologist straight away up front. And if the psychologist feels as though you might benefit from more sessions, they'll refer you to see a GP to get a mental health treatment plan, and we'll organise a specific plan for you, and that may include medications if that's appropriate, and together with the psychologist or the counsellor, we'll look after your mental well-being. In terms of sexual health services, though, we do also provide a number of services. So seeing a GP is really easy. You don't even have to come in if you're concerned because of social distancing or COVID. You can set up a telephone appointment or a telehealth appointment, and we just have a chat with you, and we can organise STI screening for you without you having to come in. So that's really a great option. In the men's bathroom in the Quadrangle next to the UNSW Health Service, there is usually a STI screening machine, which is free of charge and doesn't require seeing a doctor. But at the moment, it's currently suspended due to COVID. But hopefully, we'll let you know once that's back up and running. The UNSW Health Service also provides unlimited free condoms. So if you just wanted to come in and get some condoms, we provide that. So yeah, it's really easy. You don't have to see a doctor. Just come in. It's straight away on the wall next to reception.
Absolutely.
Can I add on that a little?
Yeah.
So for international students, if you have overseas health insurance, some insurance providers do cover your STI tests, your HPV vaccinations, and even if for women, if you're thinking about contraception, some of the insurance providers do cover a part of the cost that you might encounter.
Yep. I think these are the resources which the students might want to look at, because some of the students are not knowing about that. And as I just touched based upon that, some of the students are not also open towards talking about that. So Sylvester, probably this is a question for you now, related to the fact that how can the students feel more open to talk about their sexual health? And what is the importance of doing that? We just talked about that. If you talk about that openly, it also affects, the other parts of your body, isn't it?
I think the first thing we should look at is getting international students. I'm also an international student, although you've not mentioned that. Let me clarify that I am one. I think it is first important to make international students understand that there is a need to talk about your sexual health, and there is somebody to listen to you who will not judge you. Because from the interviews I've had, many participants kept mentioning feeling stigmatized, going to talk about sex, and the reason is simple. I am coming from a place where you should not have sex before marriage. So if I should go to anybody to tell the person I am concerned about STIs, so the person will say, oh, that means you've been having sex. So we need to have this conversation that there is a health service that you can trust that will not judge you. And then we need courage to unlearn. If you are in Australia, you are a global citizen. I am not advocating putting away your culture, because that is who you are. But there are things, we talk about cultural integration. We talk about questioning things you believe, and that is where education actually starts. If you feel that discussing sex makes you less human, you should also not forget that you wouldn't have been born if your parents didn't have sex. So sex is not something we should be ashamed of. So I think the main thing is making internationals understand that they can trust the sexual health service in UNSW in Australia, that you can seek for help without being judged. And then there is nothing shameful about talking about sex. There is nothing shameful about having contracting STI. Is like catching a cold. Something you can talk about is something that can be treated. So we should be confident. We should send that message across that, look, the health service is ready for you, and then understand that you might feel stigmatized, and then you don't have to be afraid because you've got a trusted ear to listen to you. That is one. Secondly, and very important, it is very good to talk to someone that is like you. Sometimes it works. So when you plan sexual health services for international students from a particular background, it's important to also consider that there are people that might want to talk to someone that is like them, that understands their language, because we also know that there is that language barrier. I find it embarrassing when I talk to someone and the person keeps saying, repeat, sorry, I'm an international student, I've got accents. So there is that language barrier. Even if it is not there, you feel it. I will have to go and speak English. I find it difficult. So if there could be avenues where you can talk to someone that understands your language, that is fine. And then if we can also have a platform, which Dr. Jessica mentioned earlier, that you can actually get some of these things without face-to-face contacts, that could also work. And I want to quickly suggest, if Dr. Jess can work on that, if it is possible for us to reduce the time it takes to get to someone who is depressed or who is traumatized, I think 1 to 2 days to get back is too much, because I have spoken with international students, especially in relation to COVID and mental health and stress and sex. 1 to 2 days gap. I understand the kind of weight COVID-19 pandemic is putting on the health care system. I perfectly understand. And I'm just suggesting, if it is something that is possible, even if it's going to be telehealth, if someone raises an issue, 24 hours, I think, 48 hours, I think is too much to get back to that person, because within a minute, anything can happen. Thank you.
Absolutely. And I think we also have an international student today, Saltanat. Probably, she can touch base upon this important factor that when a student is coming from a conservative background, it's very difficult for sometimes for that person to talk openly. And as Sylvester was pointing out, that you need to be confident enough about talking about that. And looking back at the fact that when you were born, you were also born out of something similar to that. So you should feel more confident and open about that. But it can be difficult at some times, isn't it, Saltanat? And what advice would you be giving to the students?
I think, Saurabh, yeah, I do believe that people coming from different backgrounds might find themselves in Australia here a bit confused, first of all, like what to do, who to talk to. And some students some people who come from such background do feel not as comfortable openly talk about sexual health. And for that specific reason, we do have a lot of events, a lot of student-led initiatives to make sure students are aware. So we have those usually students after attending such events such as Sextember, they do understand that it's okay to talk about it. And but from the postgraduate students' perspective, I do believe students in general are more mature in this topic. But I do know a lot of undergrad students who are coming from different backgrounds. And I think the most important part here is just to create that sense of trust and safe community here. And for that reason, we do have the such initiatives like in SRC, we have the women's safe room, where only women and female identifying students can attend and feel safe there. And there are places for queer community as well here at UNSW. So overall, there is nothing that else we can do unless the person would like to talk about it. The only thing we can do is just openly talk about it, so that make sure that everybody's would realize that this is a normal thing to do. Yeah. And another thing I would like to add is, again, for those who are wondering, I'm from Kazakhstan, and sexual education in school and university is not that commonly available, field. And people usually do find information from external resources, which is great. That we live in an information era where you can actually get information from everywhere else in the world.
Absolutely. And I think it's so true, that if we can talk more openly about that with our friends or colleagues, it really also sometimes impacts, your mental health. It can have an indirect impact. You might start thinking something else, also leading to, other mental health illnesses that we have been talking about in the one of the previous PGC podcast episode on managing the mental health. Sorry, I think Sylvester's hand has raised up. Yeah.
I want to quickly react to contribute to what Saltanat just said. It is important to seek sexual health information from sources you can trust. So many things can be put online by anybody. Google does not have the right or wrong answer. Google has answer. So it is important you also look at the source of your sexual health information. GPs are wonderful sources. Trusted websites like New South Wales Health is another wonderful source. And then recently, International Student Health Hub has just been launched that links you to any question you might have as an international student about sexual health in Australia. So thank you.
Yep, I think those are really important points, Sylvester, to touch base upon. Thank you so much for that. Now, I think, Dr. Jessica, we just talked about the fact that there are a lot of medical advice and support services which are available. Would you also like to touch base upon the different contraceptive methods, and what are your general thoughts on the family planning part?
Yeah, I was going to just add that the Family Planning New South Wales website is an amazing resource. If you haven't heard of it or checked it out already, please check it out. It's got amazing information about everything to do with sexual health. In terms of what contraceptive methods are available, Saurabh, there's only one method that's 100% effective, and that's abstinence. But a lot of the contraceptive methods that we have at the moment are really excellent and can give you empower you to take control of your sex life. So to start with, we've got barrier methods. As everyone probably has heard of condoms, there's male and female condoms. And these are about 70 to 90% effective in preventing unintended pregnancy because there's a lot of human error involved. So condoms can break, they can expire. People don't put them on properly. They might not be the right shape, for example. So there's a lot of human error involved. But the benefit with condoms is that they also prevent STIs. So they work in both aspects of safe sex. For the most part, in terms of the rest of the methods of contraception, they don't protect against STIs, but they do protect against unintended pregnancy. And we have the hormonal options and the non-hormonal options. So under the bracket of hormonal options, we've got the pill and we've got the long-acting contraceptive methods. So a lot of people are familiar with the pill. It's got 2 hormones in it. You take it every day. You need to take it at the same time every day. For it to be effective. It does interact with some medications, and not everyone is able to be on the pill. That's why it's really important that you come and see your doctor first. And for some people who can't be on the combined contraceptive pill, there's the mini pill, which just has 1 hormone, and that's the same principle. You take it at the same time every day. In terms of the long-acting contraceptive methods, they're preferred by GPs because they're much more effective. They're over 99% effective in preventing unintended pregnancy because they remove the human error component. So one option is the rod, which is a 4-centimeter plastic device that sits in the woman's arm, and that lasts for 3 years. It's not very expensive, just a one-off cost. It takes about 15 minutes for the GP to put it in your arm. And if you put it in the first day of your period, it's immediately effective. So that's one option. Obviously, there are side effects associated with each of these different forms of contraceptions, but I won't go into that today. Another long-acting reversible contraceptive method is the IUD, or the intrauterine device. And we've got 2 of those available at the moment. We've got the Mirena and the Kylena, which has a slightly lower dose of hormones. They both last 5 years, and we do have GPs at our practice at UNSW Health Service that can put them in as well. And again, it's a one-off cost. I can't remember off the top of my head, but I think that if cost is a big barrier for you, we do have ways that we try to help with that at UNSW. Sometimes we get samples and things that we can give out. And we are in the process of trying to get an arrangement with Medibank to have that subsidized as well. So that's a device that sits in the uterus and that lasts for 5 years. And it's very, very effective if put in during your period as well. So immediately effective. The other options are the copper IUD for people who can't tolerate hormones or just the thought of hormones upsets them. There's a copper device that sits in your uterus for 5 years and it's completely toxic to sperm. It can, there are other side effects associated with it, but it's a good option for women who, for some reason, can't have hormonal contraception. And then there are the fertility awareness methods. So there's trying to determine when you're ovulating and when it's safe for you to have sex and when it's not. That can be very, very challenging, and there is a lot of human error and a lot of training involved in that. And because of that, it's about 70% effective. But if you're
But yeah, I think Sylvester, you have an raised hand.
Yeah, Sylvester,
Maybe you can add to that.
Thank you for that wonderful enlightenment. One thing I would want to add is it will be very good if we always try to stress that there is difference between contraception and preventing STIs, because I've heard people say that our contraceptive method can actually prevent STIs, which aside condom, I do not know of any other. So I think it is always is very important that we stress that there is a difference between contraception and preventing STIs, because sometimes it's not always about what you know, but how right is what you know, and how much do you know? So these things are very, very important.
I'm sorry for that. I think I lost my internet connection in between. Apologies for that. So we are not on Facebook Live anymore, but we will continue our conversation over Zoom so that we can share the recording with the audience. Now, I was wanting to ask you, Dr. Jessica, is related to this fact that how the people or the students here can plan their healthy relationships at UNSW.
Okay, so aside from STIs and contraception, just talking about how you can, interact with someone that you're in a relationship with, I think that the most important principle is friendship and trust. So you really have to be with someone who you feel safe with, safe enough to say no, safe enough to be able to tell them exactly what you want. Because if you haven't got that friendship and that safety, there's no point being in that relationship. You're only going to get harmed. So the most important aspect of any relationship is safety and feeling comfort and open communication. So people wonder sometimes how can they can get the most out of their sex lives and sexual enjoyment, and the answer is open communication. So being able to tell your partner what you want, what feels good, what works for you, because everyone is different. No two people like to have sex in the same way.
And also maybe add on that some people are decided not to have sexual relationship, but still be in intimate relationship with someone. And that kind of a relationship is also need to be talked about.
Absolutely. As an international student, there are a lot of challenges which we are facing. in terms of the mental health, the sexual health, and also in terms of the other challenges that surround. And that really aggravates the situation. And probably, before we end today's podcast, I would like to, ask Sylvester related to this fact that, how easily it can be for the international students to transmit and contact the STIs. So how can they prevent doing that? And what do you think can be the different ways of managing that? If you would like to highlight quickly on that. I know you have touched base on some of the factors, but if you can, highlight more and go in depth for the international students.
Thank you. One thing I would want to say, quickly adds to the wonderful points Jessica and Saltanat has made, is sex is only an element in relationship. Sex is not relationship. And so there is nothing wrong having sex in a relationship. There is also nothing wrong in not having sex in a relationship. So create friendship, as Jessica said, and within that friendship, anything can happen. And it is not right, I don't think it is right to have an unplanned sex, because literature has shown that there is increased risk of both unwanted or intended pregnancy and transmitting or contracting an STI in that instance. So it is always very good to plan sex. And that is why it is important to feel confident to talk about sex. In the course of my research, someone has said, if I could remember, I go to someone's house, we chatted on social media, and then right in his house, we want to have sex, but he doesn't have condom, but I have condom. I can't bring it out because it will seem as if I'm a loose person. So I mean, these are things we should not shy away from discussing. It's not a matter of threats. It's not a matter of there is no harm there. It is just a matter of keeping yourself and your community safe. So we should be confident to discuss sex. If you are inviting me to your house, will sex be involved? Yes. Do you have a condom? No. Okay, I'll come with one. There is no shame there. So I think if we can't work on that, avoiding unplanned incidental sex, that will greatly reduce the risk of contracting or transmitting infections.
Absolutely.
Saurabh, do you mind if I add on to, one more thing to that?
Yep.
And that was a very, very, very good point, Sylvester. Just that there are other things that you can do to lower your risk of transmission during sex. So not having sex while drunk is really, really important. And literature does show that having alcohol and other drugs does increase your chances of having STIs at the time. So just be wary of that. And also there are 2 vaccines that you can get to prevent STIs, so the human papillomavirus vaccine and the hepatitis B vaccine. So just ask your doctor if you need to be vaccinated for that, because that's a very, very simple thing that you can do to protect yourself.
Yes, Sylvester.
Thank you, Dr. Jess. While I'm not playing the devil's advocate, I still want to mention that there is this risk compensation issue. Someone has been vaccinated against HPV, forgetting that he's not vaccinated against chlamydia or gonorrhea or HIV. So it becomes very complex. So that was why I'm so much in love with your starting comment or viewpoint that there is no blanket answer. Everybody is different. Everybody is peculiar. So who are you having sex with? And freely, openly discuss your options, discuss your realities. There is no shame in that.
Can I also ask Jessica, because we started talking about the HPV vaccination and hepatitis B vaccination, so maybe there are some advices. I know that the vaccine is not that is not old, so I think previous generation did not have a chance to get vaccinated, and what other guidelines for that? And maybe we can encourage everybody to do that, to think about it at least.
That's right. It is a new thing that we've instituted at school. We're vaccinating girls and boys aged 13 to 14 years in our school programs at the moment, but it is available to international students as well. And if you have Medibank insurance, they will cover it for you. The benefit of having the vaccine is, to be honest, before you have had sex with multiple partners, because most people who have had sex with multiple partners will already have the virus. So there's not much point in having the vaccine, but it is, it's still good to think about and have that conversation with your GP. As Sylvester said, it doesn't protect you from all the other STIs, but it's just a one less problem to think about.
There is a question for you, Dr. Jessica, in the chat bot, which has been sent to me only. It says that how long do those vaccines last, or is it once for the whole lifetime, and is it free in Australia?
So the human papillomavirus vaccine is free in Australia for people with Medicare, and certain health insurers for international students will cover it as well. It is 3 courses that you take, and then it does immunize you for life. The hepatitis B vaccine is a little bit different, and we've all had it. I think, even most international students would have had it in their home countries as a child, but the immunity wanes over time. And that's why we have to actually check your antibodies to see if you have immunity to hepatitis B. And if you don't, then we would offer you the vaccine. And usually that booster lasts for 20, 30 years.
Yeah, Sylvester.
Thank you for this opportunity. Dr. Jess, I had my HPV vaccine 2019. So when should I plan going for a booster if possible?
Sorry, did you say that your HPV or your Hep B?
Hep B.
Yeah, you won't need another one. You'll be right. But however, some people have the vaccine and they don't develop a strong immune response to it. It is rare, but there are a proportion of the population that do. So we always have to, there's no harm in checking your antibody levels.
Great. Thank you so much, everyone who has participated today in today's podcast episode. I think it was really insightful for me at least, and I think a lot of people who might be listening to it either through Facebook Live or probably the YouTube version later on. And I would like to personally thank on behalf of the Postgraduate Council, Dr. Jessica, Sylvester, and also Saltanat for taking their valuable time today and sharing their insights with the audience. And I also hope to see you all for the PGC Ambassador and Course Coordinator Awards ceremony, which will be on the 30th of September, where we are rewarding all the great student ambassadors and course coordinators who are making our life easier during this lockdown. And also for all the applicants, we also have a mentorship program, special mentorship program being organized on the 23rd and 24th of September with an industry mentor, which will guide you on leadership and strategic management. So I hope to see you all there, and I hope to see Sylvester, Dr. Jessica, and Saltanat in our future PGC podcast episodes as well. Thank you so much.